the bacteria that's in your gut is critical for the rest of your body. And here's why. Is because the gut is lined with millions of immune cells and nerve cells. And so the interaction that you get, even at a young age, of the bacteria and their interaction with the immune system in your gut shapes the rest of the immune system because they're all connected. So take, for instance, obesity. Take, for instance, allergic reactions like eczema or asthma. They seem to be related in part to the bacteria you have in your gut. So imagine so if you allow your children to play around in the dirt and kind of be a little bit casual about what they eat and not have them be so clean, then you introduce almost the right bacteria into the system. And what that does is allows the system to develop, and then you have a more functional immune system and a general system of we call homeostasis. So to your point, in the UK and in the US and the Western world and even in Far East Asia, everywhere I go, probiotics are taking hold. And what are probiotics? Simply put, they're good bacteria. They're good bacteria because we have an idea that all bacteria, people who don't know much about this, like bacteria is bad, it gives you infections and stuff like that. So good bacteria basically can help your body maintain a more of a balance. So for example, if you have antibiotics for an infection, it can wipe out a lot of the good bacteria. So probiotics have been shown in some studies to be able to replace that. You can get it in foods such as, for example, yogurt or any foods with fermentation, but you can also get it in supplements. For example, you can get pills that you can get all over the world that can supplement you. The things that people have to understand is that you have trillions of bacteria, trillions in your gut. So most of the supplements have billions. So it's going to take a bit of time. So you can't expect folks to get better overnight. So I tell my patients, give it weeks to get better. Don't give up on it, and it will make you feel better. As a gastroenterologist and internal medicine doctor, I think it helps tremendously with, for example, a condition called irritable bowel syndrome, where people have diarrhea and constipation, inflammatory bowel disease, gut problems in general. But I think for overall health, it's definitely useful. There are some people that say that, listen, it's not a panacea, meaning that it's not good for everything. But I think in general, if used according to the guidelines, it can really help. It can really help. Because I think we have gone to the spectrum where we're so clean that we don't introduce the right bacteria to help us live what we've done for thousands of years. So I think it's nice to get that balance back. It's wonderful to show evidence. In Nature, for example, I think a year and a half ago, they showed how obesity has been related to getting the right kind of, not getting the kind of right bacteria in your system as an adolescent. So the research is tremendous, and it's going fast. But for the person, for your viewers and people who are watching, I think if you can take probiotics in your food and also supplement, it's not going to hurt you. I don't know if everybody in the world needs to take it, but if you have any conditions of your gut, or if you have autoimmune conditions, it may be helpful.